Hi, this is Janet Kirby, and we're going to talk about healthcare and digital transformation. Welcome to the digital world. Let me tell you what I mean by that. Digital platforms are already disrupting markets broadly. Some well-known examples include Uber, which is a fleet of car owners plus a digital platform, Airbnb, which is an open source physical properties management company on a digital platform. And then there's Amazon, which is products and suppliers, plus a digital platform called e-commerce. Amazon started solely digital, then with the purchase of Whole Foods, has added a physical component. In each of these examples, there was an unmet need and a solution that was enabled by technology. In each of these examples, there represents a new way of doing business that leveraged virtual physical assets combined with digital technology that broke existing rules and legislation. But because of the scale of the value being delivered through these examples, pressure was put on the system to react with new and more embracing policies. So we're talking about physical plus digital equating to a new business model. The healthcare industry is not impervious to these new business models. Healthcare has been insulated from disruption due to the issue of opaque billing systems and the deification of doctors and regulations that suppress competition and other factors. But change is coming. Silicon Valley has been funding a number of startups that are disrupting parts of the industry. And the technology here and has been here for quite some time. So the question is, how might technology be applied in healthcare to create virtual systems that put the patient at the center of care? And in this new world, physicians become information analysts and trusted advisors using machine learning and artificial intelligence to improve patient care. Let's talk now about digital transformation. A recent definition of digital transformation is that it is the convergence of data and technology that when it's applied to customers, products, or operations, it creates actionable insights which allow businesses to improve efficiency, manage risk, or enhance customer value. One example of this is Target Corporation, the retailer, who uses data to predict the buying habits of clusters of customers. Target was then able to identify roughly 25 products, such as unscented lotion and vitamin supplements, that, when analyzed together, created a pregnancy prediction score. This information allowed the retailer to target customers for baby-related products, which increased their sales. Then, after getting feedback that the customer didn't really like being identified, Target used the data to adjust their advertisements to include other products, or randomize the advertising to include other products so that baby ads appeared to be more random, thus making it seem a little less creepy. And here's a healthcare hypothetical example. So let's take the continuous remote monitoring of patients. That monitoring delivers insights that allow for the right intervention at the right time, which over time, when combined with additional data, could create opportunities for highly personalized treatments. Now, you can take the new insights from that data and then use that to create opportunities for healthcare providers to plan for the right people and equipment at the right place and time. Let's take a look at the value scale opportunities for digital transformation. Levels 1 and 2 represent the transformations that occur within a single organization or entity. These occur across organizations with the most amount of frequency. Level 1 is typically IT-centered and primarily focused on improving or introducing new technology for the purposes of lowering operational costs or to improve operating efficiencies. An example of this is where IT moves software applications to the cloud to reduce IT expenses and to increase operational agility. A compliance-driven EHR implementation is a great example of a level 1 transformation. Level 2 transformations are those initiatives driven by an organization or a line of business that is seeking to improve upon a KPI or key performance indicator like treatment cost per patient, average hospital stay, hospital readmission rates, patient wait times, average insurance claim processing time, and the like. These initiatives are focused on benefiting a single entity and the stakeholder associated with the entity, but not the industry as a whole. Levels 3 and 4 reflect where a transformation impacts multiple organizations with the potential for transforming or disrupting an entire industry. The transformation may start by radically changing the way a single business process is delivered. Hypothetically, remote patient monitoring changes how a small set of conditions are monitored for a select set of patients affiliated with a small subset of healthcare providers. As value is proven, the transformation picks up steam. Payers adopt remote care as a standard delivery method. Technology providers create new and better form factors for monitoring, and data analytics providers come up with better algorithms for analyzing data. EMR vendors update their applications to include remotely monitored patient data, and so on. The stakeholders and partners involved with the transformation increases as you move up to increasing value. Level 1 IT-centered transformation may only reach out to involve stakeholders for the purposes of change management. Level 2 will be largely organizational and IT-centered. Level 3 and 4 call for greater involvement with external partners. And lastly, the new capabilities introduced at levels 3 and 4 influence the prioritization of organizational and IT transformations. IT may need to upgrade their infrastructure to account for new capabilities that support new business models. Organizations may need to restructure to adopt new business capabilities. This restructuring is not limited to single organizations, but may span across organizations across an industry. So, as you think about the project that you take on for this course, consider where your strategy falls on the scale of transformation. Are you adopting a new capability that drives transformation to your organization? Or are you seeking to develop a completely new business capability? And if you are, how would you plan to partner with an organization to get your very first implementation so that you can start to prove value? Who are the industry stakeholders and partners that you need to collaborate with? So why healthcare and why now? We're going to go through 4 different reasons for why transformation is happening in healthcare today. We all know that innovation is critical to the future of healthcare, and in fact, there's a list of over 2,200 healthcare information technology startups on Angel's List, and that's a clear indication of the interest to invest in transformation. So let's look at those forces for change. Let's start by talking about the cost of healthcare in the US. As we all know, employees are shouldering more and more of the cost burden of healthcare insurance, and with more patients either stepping away from insurance completely or avoiding care until it becomes an emergency, U.S. healthcare is now delivering less through declining utilization for more and higher cost. Thus, it's making the healthcare industry ripe for disruption. The bottom line oriented employers, cash-strapped families, and tax-starved governments will insist on it. As pressure builds, a whole new innovation industry within healthcare has come into existence. It includes startups looking to help existing providers improve the efficiency of their operations, the quality and safety of outcomes to their care, and their patient or customer relations. Okay, let's look at the role of demographics and its impact on healthcare transformation. We'll start by taking a look at the millennials, which is a big bubble. Millennials tend to be light users of healthcare, at least so far, but according to experts, millennials grew up on the internet and with mobile technology, so they expect digital to be a part of their life. The millennial generation inhabit the world of a gig economy where telecommuting is common and everything is streamed in real time just as you need it. Think Netflix and Amazon. And the lines between home and business have become blurred. Millennials use their smartphones at the office, they work from home, and this has led to the consumerization of corporate IT and is also leading to the consumerization of healthcare. Then looking at the next big bubble of baby boomers, a large number of boomers with acute and chronic care needs will clearly challenge the healthcare system. So some statistics on that. 80% of Americans 65 years and older will have at least one chronic disease. And 70% of baby boomers have used at least some form of complementary or alternative medicine. And then 20% of today's baby boomers are members of minority groups. That percentage will grow to include larger immigrant families, and lifespan gaps between minorities and health and non-Hispanic whites will shrink. Almost 90% of boomers graduated from high school. The implication is that boomers will be more likely to want to engage in their healthcare decisions. And a more ethnically and racially diverse population will require delivery systems and caregivers that are sensitive to cultural differences. All of this is demanding innovation in how we deliver healthcare or business model innovation. Next, let's look at the consumerization of healthcare. 81% of patients are dissatisfied with their healthcare experience. 1.4 million Americans will travel outside the U.S. for medical care in 2017. And greater than 160 million patients visit WebMD every month, which is more than visits to regular doctors in the U.S. Years of double-digit increase in healthcare costs, the growing gap in employer healthcare coverage, and now the advances in technology that allow for easy access to quality and cost data have empowered consumers. Consumers are taking a greater hand in managing and paying for their own health. Consumerization acknowledges the role of the customer and the need to fully engage them in an end-to-end customer experience, and has already spread to service companies in banking, insurance, and is impacting healthcare. Significant change is required to thrive in a consumer-centric environment. The winners will be those companies that can successfully apply a deep understanding of customers through big data to develop new business models, capabilities, and offerings. Okay, enough about patients. Now let's talk about labor. Retiring baby boomers also impact the supply of healthcare labor as the demand for services is increasing. It's estimated that the shortage of registered nurses will be over 1 million by the year 2020. To meet that need, it is estimated that the number of new nursing graduates would have to increase by over 90% per year. The physicians shortages are also projected to increase as boomers age, with a gap of 130,000 specialists and over 60,000 primary care providers predicted by the year 2020. Investment in technology can play a huge role in increasing the efficiency of labor in healthcare. Also consider the pressure for disruption to educational systems as the need for more labor puts pressure on capacity. So what we need here is to also look at where can we innovate in the space of productivity so that we can optimize our labor supply. Healthcare disruption is already happening. So let's take a look at the disruptors and where we're seeing consolidation. If there is to be a healthcare revolution, it will create winners and losers. Andy Richards, an investor in digital health, argues that three groups are fighting a war for control of the healthcare value chain. One group is comprised of traditional innovators, and those consist of pharmaceutical firms, hospitals, medical technology companies such as GE, Healthcare, Siemens, Medtronic, Philips. The second category could be called the incumbent players, which includes health insurers, pharmacy benefit managers, which buy drugs in bulk, and single-payer healthcare systems such as Britain's NHS. The third group are the technology insurgents, which include Google, Apple, Amazon, and a host of hungry entrepreneurs that are creating apps, predictive diagnostic systems, and new devices. These firms may well profit most handsomely from the shift to digital. In just one example of consolidation with hospitals and health systems, according to the Healthcare Financial Management Association, or HFMA, the transition from volume to value and corresponding more to population health management requires sophisticated management expertise and significant capital investment. This is also shifting the nature of the merger transaction. Rather than stronger organizations acquiring weaker ones, it is increasingly likely that a strong player will merge with another strong player. And that consolidation has been accelerating. Consolidation is not without controversy. There are concerns about the effect of consolidation on price. On the other hand, there are claims that consolidation is essential for achieving greater efficiencies and facilitating population health. So we've talked about the business reasons for why transformation and disruption is happening within the healthcare system. Let's now talk about the technology aspects of transformation. There's a great quote from Thomas Friedman, the author and Wall Street, New York Times author. He says, "We're moving into a world where machines and software can analyze or see patterns that were always hidden before, optimize, which can tell a plane which altitude to fly each mile to get the best fuel efficiency, prophesize, which tells you when the elevator will break and fix it before it does, customize, which means tailoring any product for you alone, and digitize and automate just about any job. This is what's transforming every industry." So if we look at that, specifically, we talk about analyze, optimize, prophesize, customize, and digitize. So as we go through the next slides, we'll talk a bit about how this is happening with technology. Of different technologies, let's dig into a little bit about what do we mean by digital transformation. We could also refer to it as business transformation. Digital transformation is more than just the implementation of technology. It requires changing how work gets done. This means that businesses will need to embrace a change in their business scenarios, which may also impact organizational culture, including how businesses are organized to get work done. Digital transformation should equal value creation. This slide depicts examples of areas within healthcare that could be transformed through technology. Care delivery. What if you could use big data to predict patient load and then optimize capacity within the facility? What if you could use patient population data combined with other sources of data to predict situations where patients are at higher risk? What if you could use remote technologies to deliver care to patients for whatever reason, to patients who cannot make it to a facility? Or what if 3D printing could make affordable technologies that would otherwise be out of reach for a patient? Patient experience. How could you streamline the patient experience by eliminating redundant processes and paperwork? What would it take to create a care plan that is personalized to each patient's needs? Talent development. Can you reduce staff turnover simply by using more intelligence in your recruiting systems? What about scheduling systems that understand peak loads and staffs accordingly while taking account employee needs? How can you create a learning environment that is conducive to real-time learning? Operational efficiency is a critical area for reducing costs. Where are there opportunities to automate tasks? Are there better ways to manage the supply chain so that inventory costs can be reduced, yet supplies are available when they need to be? How much more productive would you be if you knew exactly where staff, supplies, and equipment were? How can blockchain be used to create data interoperability and security? And then if we look at smart healing environments, with the Internet of Things, things can talk to things, people can talk to things. And big data and physical environments can learn and to respond to the preferences of the patient. These business value propositions are enabled through the different technologies that underlie them. In the darker color here, 3D printing, virtual reality, blockchain, and robotics represent technology capabilities, whereas in the lighter blocks, mobile portable devices, Internet of Things, cloud computing, and big data are technologies that deliver technical capabilities like 3D printing, virtual reality, etc. And all of those could be ingredients to an end-to-end digital transformation that delivers value. What we're talking about here is business transformation enabled by technology. So next I'm going to provide you with 5 examples of technologies that are transforming healthcare today. In home soon, or maybe already in your home today, are chat boxes. According to MIT, the growth and adoption of smart speakers are expected to surpass the growth rates of tablet and the smartphone. Making this possible, voice word accuracy rates have increased to better than 90%. According to a recent study by Wix, 2 out of 5 people say that voice-activated devices are now essential in their lives. What possibilities does this create for healthcare? The Robotics Business Review identified 3 strategic applications directly related to healthcare for robotics, and I'll also talk about a 4th area. First, let's talk about direct patient care, which could be represented by surgical robots used for performing clinical procedures, exoskeletons, and prosthetics. Robots have the potential to augment surgeons with superhuman precision and repeatability. Da Vinci is an example of a surgical system by Intuitive Surgical that has been used successfully on minimally invasive procedures. Next, there is indirect patient care, represented by pharmacy robots that streamline inventory control, reduce labor costs, and then there's delivery robots, disinfection robots. Robotic medication dispensing can provide a solution for securing and tracking medication deliveries in real time. An example of this is RX Safe, which provides secure robotic storage and retrieval for retail pharmacy inventories. Next is home healthcare robots. These are the biggest example today is of telepresence solutions, but also included in this category are companion robots like Pillow that can manage medications, answer medical questions, reorder medications, and send notifications. Really, this is a medical Alexa. Last are robots used in operations. Healthcare can look to other industries to find robotic solutions to operational products. One of these is in the area of supply chain. Hospital supply chain is a fast-growing expense for providers, second only to labor costs. Consolidation and centralization of resources could create significant cost savings. Enhancing these initiatives with automation that creates connectivity throughout the facility enables visibility to the value and location of inventory, including medication and supplies. Robot technology is becoming cheaper and more capable as the sensors and software that enable them drop in price. In the future, it's predicted that there would be microbots that can travel through bodily fluids to deliver medication or repair damaged cells. We're just beginning to see the impact of IoT on healthcare value creation. The adoption of IoT applications in health and fitness is well underway. According to McKinsey, the economic impact of IoT in health and wellness could be 170 to nearly 1.6 trillion globally by 2025. The largest source of value could be through the use of IoT devices to monitor and treat illnesses. The second largest source of value could be from the use of data generated from wearables to track and modify diet and exercise routines. Other potential areas for value creation can be borrowed from what is being learned across industries. For example, energy management, predictive maintenance of machinery, and inventory optimization. AI, or artificial intelligence, represents a collection of multiple technologies that enable machines to sense, comprehend, act, and learn. With the power to make immense improvements in cost, quality, and access, the AI market is expected to reach 6.6 billion by 2021, and also is estimated to potentially save the healthcare industry 150 billion by the year 2026. This slide represents a few of the examples cited by Accenture and the medical futurists as having the greatest impact on healthcare. Robot-assisted surgery is expected to provide 40 billion in annual value by 2026, and virtual nursing assistants could add another 20 billion in value. Also, by 2025, Forrester expects that cognitive technology, which includes AI and automation, could or will replace 7% of US jobs. Virtual reality gained popularity from applications in film, gaming, and adult entertainment, but is quickly being applied to healthcare. Here are 3 promising use cases. High-performance computing paired with VR makes it possible to merge MRIs, CAT scans, and ultrasounds to create patient models to practice on before surgery. 6 out of 10 physicians in the US are already using VR to practice surgical techniques. Use of VR for training could improve the time that it takes to perform surgeries and improve patient outcomes. Use cases for patient treatment are just starting to emerge. For example, the company MindMaze uses VR to treat Parkinson's patients, amputees, and stroke victims. Lastly, as we wrap up, let's talk about 4 strategic steps in digital transformation. First, discover. Envision the future. Where does the business need to go? Assess the current situation, but look to where the business needs to be to deliver value. Use both data and imagination. Design. Put the right people and processes in place to drive the transformation. You'll need to decide who will lead the plan and what governance you will need in place to ensure success. Look across the ecosystem, identify the relationships needed to partner for success. A well-communicated vision is essential to recruit and engage support. Have a message that resonates with each of your stakeholder groups and a plan to propagate change. Deliver. Execute to the plan, allowing for ongoing adaptation and adjustment. And then lastly, de-risk. Decide what to do and when. Minimize risk by sequencing the transformation to achieve quick wins that yield early payoffs that can fund further investment. As we go through the rest of the remaining weeks of this course, we will be talking about strategy, and there will be deep dives into the different areas that are covered through these strategic steps, such as how to define a vision that communicates value, how to put the right governance in place to ensure success for your strategy. So with that, thank you.